Imagine this. You are a nurse working in the emergency department. The emergency room is overcrowded with patients scattered throughout, there's long waiting times, and patients are continuing to flow in faster than you and your fellow coworkers can triage them. As you're working the emergency room trying to keep up with the patient load, you're exhausted and find it hard to keep up with triaging them in a timely manner. Nurses may find it difficult to triage patients in a timely manner in the emergency room, and due to human bias and the rapid, uncertain nature of the ED, this can result in under-triage or over-triage. Causes of the increased patient load in emergency rooms include but are not limited to staff shortages, extended boarding times, non-urgent visits, reduction of downstream beds, and frequent visitors. The overcrowding in emergency rooms all over has a negative effect on various patient outcomes such as complication rates, mortality, patient satisfaction, walkouts, time of treatment, and length of stay. How can we improve these conditions? What technology can be introduced in order to offer a solution? The answer is an AI-based triage system in emergency departments all over. As described by Tang et al. 2021, implementing AI has the potential to improve triage classification, diagnosis prediction, prediction accuracies, and ED workflow. It can also assist in determining urgent care for patients, predicting clinical outcomes, and enhancing communication and coordination in the ED, as explained by Tyler et al. 2024. As shown in the diagram, AI can be implemented at various stages in the hospitalization process. Chenais et al. 2023 explained how before patients even come to the emergency department, a self-triage system powered by AI can assist potential patients on a self-assessment. This assessment determines if they need to seek care and where to seek it, as well as for what diagnosis, based on the symptoms they have entered, their response to the questions asked by AI, and their medical history. With emergency service dispatch, the use of AI-assisted systems have already been used and shown to be effective in promoting improvements. Chenais et al. 2023 describes how these systems analyze the caller's speech and the description they're providing and suggest advice on which questions to ask next, indicating when the patient may have experienced a particular negative health event, such as a stroke. Chenais et al. 2023 further explains how the system then gathers information on the caller's location and dispatches EMS to reduce the time it would take to complete that call and gain the information through a human operator. In regards to the registration process, several studies have already demonstrated success with linking their electronic health records with EMD systems. A study by Redfield et al. 2020 yielded successful results when linking EMD electronic patient care reports with the EHR system at their hospital, eliminating the need for manual review. This supports the linking of the two systems and providing an initial medical screening to potential patients upon arriving to the ED that will allow them to answer questions using a smartphone or a digital kiosk. Triage nurses must quickly assess a large number of patients in order to declare their urgency for needing to be seen by a medical professional. Oftentimes, patients flow in faster than triage nurses can keep up with the patient load. AI-based triage can reduce this burden on nurses. In a review by Hinson et al. 2018, they identified several studies that reported low sensitivity in human clinicians identifying critical illness outcomes in patients who passed away during their hospitalization. Due to issues regarding accuracy, various AI-based solutions have been tested and revealed an improvement in the decision-making of healthcare professionals, resulting in better clinical management and patient outcomes. AI can also assist healthcare professionals in consultation. AI can be used to interpret images and predict mortality, morbidity, admission, and length of stay, as described by Chenais et al. 2023. The introduction of an artificial intelligence-powered triage system has the potential to assist healthcare professionals in overcoming challenges in regard to organization, coordination, and the need for fast and accurate decision-making for high-acuity patients in the emergency department, as stated by Chenais et al. 2023. Through previous studies, incorporating AI has already been shown to be effective in rendering improvements in diagnosis, triage, imaging interpretation, medical decision-making, and various other areas in the emergency department setting, as stated by Karubajan et al. 2020. In order to improve the current triage system in emergency rooms, AI-based triage should be implemented, which will positively impact ED workflow. Updating the current triage process to be AI-based has the potential to yield numerous benefits for organizations, healthcare professionals, and patients alike.